now I'm going to talk about a broader thing that colleagues have brought up, certainly our patients have brought up, and I don't know what the atmosphere in the Philadelphia, Jersey sort of tri-state area up where you is, but we have a lot of a particular commercial store that's available where you can get orthotics that are made at the store. There are not doctors there. And it is also a place where you can get better footwear options like Rockports, Sam Hubbard, Mephistos, etc. I sort of call it the retailization of podiatry. On the one hand, you have these great graphics, they'll be right after the Today Show where they had just had some foot guru that is really a glorified ex-yoga instructor or something like that, talking about, the best shoes to get your foot, and they'll segue right into one of these commercials. And then your senior patient watching, Al Roker do the weather, they'll come in and they say, I've already got a round of orthotics that cost me, X amount of money. And they're usually very expensive for these sort of pre-staging orthotics, etc. Give me your sort of overall take. Now you're talking to both doctors and the lay public, because I'm sure if I tag the name of the one particular place in general, people maybe spark their interest. What's your thought, though? You've been doing this a long time. What do you think?
Well, first of all, it's competition. I mean, quite frankly, that's what it is. And if you want to win the competition, you got to offer a superior product. And it's that simple. And any discipline, anything, the public is going to want quality, and the public is going to want, reproducible quality. I happen to think a good neutral position cast, suspension cast technique for orthotics or some type of 3D computerized technique is the best way of accomplishing an orthotic today. And I think you get what you pay for a lot of times. I just had a patient, went to a local Podorthist facility, and they had the patient stand in foam boxes and made the orthotics out of the foam impressions. And the patient comes back in and brings the orthotics and said, I got the orthotics, like you said, doc, and they don't seem to be helping. And I could put both my fingers between the top of the orthotic and the bottom of the patient's arch. I mean, it's just amazingly poor. But I don't think this competition is going away. I think I remember the one we can all talk about. It won't go to the one I think you're referring to, but is the Dr. Scholl's, where you go in and you step on the device right in the Walmart. And I remember a patient one time with severe flat feet said, I went in and I stood on the machine and I put 1 foot on at a time, and it kept telling me 1 foot at a time. And I only had 1 foot on there, but my foot was so flat, it couldn't recognize it as just 1 foot. And, how can that possibly compare in the quality to what can be done by a competent sports medicine physician or podiatrist, or somebody that's expert in making a custom molded orthotic? But I think it's all about, we need to educate the public. We need to show why our products are superior. And, that's going to be done, through different sports medicine organizations. It's going to be done in our publications. And it's going to be reaching the lay public's publications, Running World, other magazines that, sports medicine oriented, and educating them as to, where the best orthotics are made. I think there's no comparison to a well-made orthotic by a competent sports medicine person than going to any of these stores where, you got the kid right out of high school working after hours in the place and has some limited knowledge. I'm not going to say they have no knowledge, but they have far less knowledge in the training that the average podiatrist or average competent sports medicine specialist goes.
Yep. So I think the other part of the PSA with this is that it's kind of like the old, elephant looking at the trunk, but not seeing the whole elephant. They could well have a limb length discrepancy. They could well have some kind of osteochondrosis. They could well have, and very rarely, but we've seen them, they could have some kind of tumor. It's not always plantar fasciitis. So, we also have to appreciate the old saying about when you're looking in the barn, you're looking for horses, not zebras, but sometimes the zebras do show up. So I think there's that part of the equation as well.